Wes, I got a question for you from Reddit. I keep up with the job reports and things are looking dicey. If we were to enter a recession, is the profession largely affected? I'm only 1.5 years out. My current job is okay. I feel like I'm not doing as many fixed units as I should be. That plus they're cutting benefits like health insurance and a moonlighting clause. I'm thinking of jumping ship sometime next summer, but with a potential recession, maybe best to stay put. I work for a small DSO that is open after hours.
Yeah, so I'm going to start with a couple answers here. Dentistry has survived every recession over my 37-year career. Only the high-end niche practices have been affected. That's largely true. Dentistry is very, very recession-proof. However, I'm going to come back because there's some other concerns kind of reading in between the lines here of this question that I think are issues. Just wait until tariffs balloon your equipment and materials costs. That'll be super fun. Yeah, increased costs are probably driving what's happening to this dentist more than necessarily a recession. But we've seen, as we talked about on our Drilling It Down podcast, there's signs of a recession. We're not here to argue that one.
Yeah.
Here's a good one. In practice since 1998, worst was the 2008 recession. People postponed some treatment, but pain is a big motivator. Saw an uptick in extraction and downtick in endo. Overall revenue was flat during the recession. Some months saw a decrease and absolutely sucked. No year-over-year growth, but made it up with increased revenue once economy was doing well. Suggest you sharpen oral surgery skills, do more guided tissue grafting. Once the patient rides out any recession, place those implants. Need to be flexible. I'm not going to continue to read the rest, but this right here is a really, really good example. You know, the hygiene departments will run, dentistry will still get done, people will get the pain, but some of those higher end cases, you know, hey, make sure you meet them somewhere in the middle if they can't afford it, maybe flexible payment options. But I think this dentist in particular, a little scared to jump ship because they're scared of a recession. Now, some practices, you know, hey, if there's a one doctor practice you're coming on, they're hoping to grow it, a recession could impact that. Not every practice is going to be impacted. It depends on the demographic. You know, a demographic of retirees ain't really going to be affected these days. But this DSO, there's a little bit more behind this that I think is causing the pain this doctor is going through. He had mentioned cutting benefits. So DSOs go out and they borrow a lot of money to buy practices, start practices, and they really rely on associate doctors. And because of this, their marketing, there's not a lot of loyalty to the brand. There's not a lot of doctor-patient relationships. So a lot of them came into the business right before staff cost went up, and the private equity people, never really considered that one dentist and another dentist are not the same person. So they bought a lot of practices from 55, 60-year-olds with great reputations. Those doctors disappear. The new patients disappear. They go in network. They're getting cut off by the insurance companies, so their profit margins are squeezed. None of them, and I mean none of them, anticipated how hard it would be to hire a hygienist. None of them. I got it straight from one of the CEOs at Blackstone, that none of them anticipated this. And I was laughing the whole time because we work with private practitioners. I'm like, yeah, y'all should have never entered dentistry. So this isn't a reason to not hop ship to wrap up. It's not a reason to not go get a new job. It is a reason to be careful of the next job you're getting. Make sure you ask, hey, how many new patients per month we're getting? Are we insurance based? Is there enough work for me? If it's a DSO, it might be a DSO that is going to be fine. It's all insurance based. If it's a private practice, hey, why are you hiring an associate? You know, how many new patients per month are you getting? Are you comfortable giving up some of your work to me to figure out if you're going to be busy? And he's only 1.5 years out. My job is okay. My best advice to you is get in a position to buy a practice. Dental is one of the best industries to be in. You should be a practice owner. But hey, otherwise, I thought we had some good tidbits here.